So pet ownership and adoption has skyrocketed in the U.S. over the last 10 years, but the most dramatic spike was seen during the pandemic. More than 11 million pets adopted in 2020 alone. It created a unique strain on the animal care industry, with more animals in need of veterinary care and more veterinary offices seeing low staffing, burnout, and strained resources. Now, here in Western Washington, general practices saw average wait times from 10 to 21 days in 2021, and that's a 600% increase compared to the pre-pandemic average of 0 to 3 days. Emergency hospitals seeing so many critical patients that the average wait time is 6 to 8 hours right now. And this morning, we introduced you to a pair of women working towards a simple but important goal, filling the gap between emergency care and general vets. L&L Animal Urgent Care, now the first of its kind here in Western Washington, run and operated entirely by women. And joining me now, Sydney Roy and Dr. Stephanie Stogbauer. Good morning to you.
Good morning.
And it looks like you have a couple of satisfied patients there with you right now. So your practice opens its doors for the first time in just a matter of hours. So what can folks expect walking through your door today?
Well, we hope that we have, it's always a hard one because we're here to help sick and injured pets. So you're never excited to see anybody come through the door, but we're here. We want to be able to help them because we know that it's been a really big need, that we hope that we can help support both our pet owners, that truly it's been a struggle. We recognize how hard it is. I think that anybody that owns a pet for the past 3 years understands how difficult it has been to get into a vet. And on the other side, it's the fact that our veterinarians are, doing absolutely everything humanly possible. And we're here to support them too, because it's a level of, we have had, like you said, so many pets adopted the past 3 years. We just don't have enough staff to be able to support that. So we're trying to help to go ahead and give our veterinarians and veterinary staff support as well.
So tell us about what urgent care for pets looks like and when a pet owner should be seeking you out.
Absolutely. So it's a big difference between emergency care and urgent care. If there is something that is truly life-threatening, that a dog has been hit by a car, needs to be hospitalized for 24 hours, absolutely, that's going to be something that you go to an emergency room. An urgent care facility is where you have a stable but sick pet. So things like really bad ear infections. They're having horrendous diarrhea all night long. Urinary tract infection. They can't hold their bladder. Things, if they have, gotten into a fight at the dog park and they have wounds or lacerations, a cat that has an abscess. Those are all things that we're going to be taking care of because we do have the surgical capabilities of doing these smaller, minor procedures that aren't requiring a sterile field. But at the same time, they're not going to be the life-threatening ones where you need to have an invasive abdominal surgery.
Just as we've seen all across the healthcare sector, veterinary medicine saw high burnout rates during the pandemic. So how does your practice help ease the strain on existing vets?
We definitely are trying to kind of bridge that gap between the urgent care, or between the emergency room and the general practice. So we are here basically to relieve both of them. We want to make sure that the general practices have open appointments for new puppies, new kittens, regular vaccines, regular wellness exams. But the ERs, they need to focus on the more life-threatening, more, obviously emergency cases. And so we're here to take that in between of things that need to be seen sooner than a couple weeks, but don't need to be seen right this second, life-threatening things.
Yeah. I mean, my best example, I think, is, a dog who's running plain fetch at the dog park and honestly blows out its knee. It's not something that's life-threatening, but he's really painful and he needs to be seen by somebody the same day. And to be honest, 5 years ago, it was something that your regular GP veterinarian was able to see that, to be able to squeeze you in. And I think that's one of the things that's been a big struggle for a lot of pet owners to understand, is that I used to be able to call and I used to be able to get in the same day. And right now, that world just doesn't exist. My background is I basically did emergency medicine for 3 years. I was in general practice for 6. Then I've been doing relief work for the past 8 years, meaning I fill in at over 30 different hospitals in the greater Seattle area. And this is across the board. This is every veterinary hospital has gone through this in the past 3 years. And it's made it be a true concern that the staff is burned out. They have already filled all of those emergency spaces of the space where we could go ahead and help them out. And by the time that an owner has honestly gotten the call to say, I'm so sorry, we are full, we can't help you, they're probably call number 7, 8, 9, 10 of the day that is the point that we're at. So that's where we're really trying to relieve the stress, because honestly, it's hard on our veterinary receptionists and staff. We hate saying that. No one wants to say, no, we can't help your pet. But at this point in time, we're giving them an option to say there is somewhere that you can take them, because like Sydney said, the emergency rooms that are taking care of our critical patients, they just don't have the capacity to take this on either.
Sydney Roy and Dr. Stephanie Stogbauer, thank you so much for joining us. And by the way, you can find L&L in Kirkland, which operates first come, first serve walk-in care starting today. So we're highlighting women who make Washington the state it is today. And if you know a woman who is creating change and has a story to tell, shoot us an email and make a nomination.